What is the optic nerve's connection to the brain in optic neuritis? Imagine your vision as a busy highway carrying messages from your eyes to your brain. The optic nerve is the main road that makes this possible. It acts as the critical link that transmits visual information from the retina, the light-sensitive layer at the back of your, directly to your brain for interpretation. In optic neuritis, this highway becomes damaged because of inflammation, which disrupts the normal flow of these visual signals. This inflammation affects the protective covering called the myelin sheath that surrounds the nerve fibers, similar to how insulation protects electrical wires. When the myelin is damaged, nerve signals slow down or stop altogether, leading to sudden vision problems. The optic nerve itself is made up of about 1.2 million tiny nerve fibers called axons, which originate from retinal cells known as ganglion cells. These fibers converge at a spot called the optic disc in your eye, then exit through a tiny opening called the lamina cribrosa. From there, they travel through the optic canal inside your skull to reach the brain. The nerves from both eyes meet at a point called the optic chiasm, where some fibers cross over to the opposite side. This crossing allows your brain to process visual information from both eyes correctly, especially the opposite visual fields. After crossing, the signals travel along pathways called optic tracts to a relay station in the brain called the lateral geniculate nucleus in the thalamus. From there, the signals are sent via optic radiations to the visual cortex in the back of your brain, in the occipital lobe, where images are formed and understood. In cases of optic neuritis, inflammation damages the myelin sheath, which slows or blocks the nerve signals. This can cause symptoms like sudden loss of vision, pain when moving your eye, and changes in how colors appear. Because the optic nerve is part of the central nervous system, its inflammation is often linked to conditions like multiple sclerosis, a disease where the immune system mistakenly attacks nerve coverings. The disruption in signal transmission results in the visual impairment seen in optic neuritis. Understanding how the optic nerve connects to the brain helps explain why inflammation here can have such a big impact on vision. When this pathway is damaged, the flow of visual information from your eye to your brain is interrupted, leading to vision loss or disturbances. Recognizing this connection is essential for diagnosing optic neuritis and related neurological conditions. If you experience sudden vision changes or eye pain, it's important to see a healthcare professional for proper evaluation and treatment. Always remember that each person's situation is unique, and medical advice tailored to your specific needs is key to managing eye health effectively.